Hi, my name is Dr. David Kane, and today's video is all about migraine headaches, and not just talking about migraine headaches, but actually giving you a walkthrough as to exactly the sort of things we look for people who do suffer from migraine headaches. If you're a sufferer, you understand just how uncomfortable it can be. It's that pain underneath the base of your skull sometimes, it's the pain in behind your eyes, it's that need to get away from light, hide in a dark room and just nuzzle yourself away. In that case, what we really want to do is make sure that we are doing a full ground-up examination on you. But one of the more important things we look at is taking X-rays. So I'm going to quickly show you some X-rays and we'll explain to you what we look for in this particular patient, a 45-year-old female who had a history of migraines dating back about 22 years. So we'll get straight into it. Now, if you can imagine, with an X-ray, what we want to look for is nice straight alignment. And so in this instance, we've got deviation of the spine. So as opposed to standing up nice and straight, we've got somebody who's just off to one side. And in this case, the client is leaning off to the right-hand side. She had also experienced severe neck discomfort on and off for a period of 10 years. Wasn't ideal. But to add insult to that injury, she was sitting in front of a computer for a good part of her day. Now, if that sounds like you, then you're not alone, because a lot of people are finding themselves stuck in front of that computer. So we look for the alignment of the spine. We can see that there's deviation, but we also see that there's small, subtle deviations between each bone. As a chiropractor, we call those subluxations or misalignments, and that can cause irritation onto the spinal cord itself. The second part of this examination, though, was taking an X-ray from the side. And I'll just sort of zoom this in for you. So if we bring this right in through to here, we can see that on our X-ray here, the perfect curve or the perfect angle of the neck is demonstrated here in yellow. You can see that there, highlighting in pink. So that's the perfect curve. Now, if I took that away, you can see that that neck there is all but perfectly straight. Now, that's not ideal because the spine itself is designed to twist, it's designed to bend, it's designed to move. And with that, we've of course got impacting up the top part of the neck, and we've also got irritation of the spinal cord itself. Now, it didn't take a long time for symptoms to start resolving with this particular person, because we focused very keenly at the top part of the neck. We wanted to make sure that that part of the spine was looked after. We wanted to make sure that it was moving well, because this particular person had very tight muscles at the top part of the neck. We examined her range of movement and flexibility was poor, and the entire bundle of nerves, we just extrapolate and believe that that was quite irritated and compressed. It didn't take long, as I said before, and what we really focused on doing is increasing the curve into this neck. Now, we didn't have an after picture for this particular client, but what we were hunting for was an increase in the C-shaped curve of the spine. In fact, we have got one here of a before and an after, and so I'm hoping you can see that here. And so on the left-hand side picture there, we've got a before, and that shows that there is a very straight curve. We've also got the yellow line in through there just to show what it potentially could look like, or what it should look like. And then on the right of screen there, you can see the improvement that we did see after a period of, I think it was about 8 weeks in this particular client's case. And so if you do get migraine headaches, it really doesn't have to be something you have to live with. Even if you could reduce the frequency, if not the intensity, that would be of huge benefit to somebody. And so if you're sitting in front of a computer, just think about it. It's going to likely put a lot of extra pressure onto your spinal nervous system. And if you're kind of going, you know what, I don't need to deal with this anymore, then by all means get in touch with us and we look forward to helping you out.